Good evening. I'll just introduce first of all the people on the call. So we've got NPA Chair Olivia Pickard, NPA Vice Chair Suki Basra, Head of Pharmacy Advice Jasmine, and one of our members Richard Brown on the screen. So the plan this evening is to first of all, well, in a couple of minutes, I'm going to hand over to Jasmine to run through the regulations as they stand and the proposed changes to regulations. I'm going to ask Olivier to say a few words actually about this change from his perspective, having been on CPE as this has gone through. We've got a number of some quick polling questions to run through. Richard's going to then talk to us as an affected contractor, and then we'll open it for questions and comments for everybody. This evening is very much for us a listening opportunity to listen to affected members, understand what the implications are for you. We're not in a position this evening to promise to do anything in particular, but we want to hear what the issues are, what might be helpful. We can then go away and confer with the NPA board about the next steps. We are recording. This is just to share with those who we know at DSP pharmacies. So it's a limited list that we would share with, just to reassure you this isn't going to be sent far and wide. This is just to share with those who were unable to make it this evening. A number of people have expressed an interest that haven't yet arrived. So it's that group of people that we'll share the recording with afterwards. So to kick off, I'm going to hand over to Jasmine to talk through regulations as they are at the moment and the changes that are proposed as we understand them, just so that we all understand what is likely to be happening. So Jasmine, over to you.
Hi, thank you, Gareth, and hi, good evening, everyone. Just going to share my screen. So hopefully you should all be able to see that in a minute. Excellent. So just want to run through very quickly with some of what the proposed changes exactly are for the DSPs. Gareth has just explained what today is about. So I'll roll on very quickly. And in a nutshell, this is what the proposed changes mean for us. So currently, as it stands, DSPs are not permitted to deliver any essential services on site from the DSP pharmacy premises. It has to be all provided remotely. However, at the moment, advanced services as well as enhanced services and national enhanced services, for example, NMS, most elements of Pharmacy First, flu vaccination services, COVID vaccinations, they can currently be provided as a service on site from the DSP registered pharmacy premises itself. What is going to be changing, and this will happen after the relevant apologies, my screen share has just failed. 2 seconds. So once the pharmaceutical and local pharmaceutical services regulations have been amended, and we expect this to happen around about October time, from that time onwards, DSP pharmacy premises, it will no longer be able to provide those services from on-site at the pharmacy premises. However, as you know, there are many services already in existence where the service specification permits off-site provision of the service. And where this continues to be, that will remain in place, not just for DSPs, but all other pharmacies as well. So, for example, what will then need to change is any services currently being able to be provided on site from the DSP premises face-to-face will no longer be able to do that. It will only permit remote consultations once the legislation is amended. However, certain services will be able to be provided off-site, including have that face-to-face contact with a patient, but not on the DSP premises. So, for example, to the best of my understanding, this could be what the likely impact is for each service. So as you can see here, I have picked out all the services, but if I can pick out maybe some of the ones that we've been asked about the most, for example, Pharmacy First service, There will be no on-site provision at all from the DSP premises. However, it will be possible to continue to provide remote consultations from the DSP premises, however, with the relevant exclusions still in place as per the service requirements. But remote consultations from off-site will not be permitted, etc. So I've broken down what I believe will be what will be the likely outcome, all to be confirmed, of course, in line with what the legislative wording is. But this is likely to be the outcome for it. Now, we've had a lot of questions from members around the flu vaccination service specifically and the COVID vaccination service, because obviously orders for those vaccines will have been placed before this announcement by pharmacies, and wondering, what will happen to that come this next flu season. And indeed, in some cases where pharmacies have been commissioned to provide the COVID vaccination service right up until March 2026, what does that mean? So in case you've not had a chance to look at it, CP has provided some information on it. I'm just going to share exactly the wording on it, because this is, again, something that I've raised quite seriously, and as NPA, we've raised it. So our current understanding based on this information is that it is likely that the DSP pharmacies who are currently, or signing up to provide the flu service as well as part of the COVID vaccination service, will be able to provide that just for this season only. But that sort of leeway will not extend to any other advanced or directed services. That is our current understanding. So that is, in a very small nutshell, the changes that we're expecting to come in. So I'm going to stop sharing my screen at the moment, just to go back and allow the discussion. Gareth, over to you. Thank you. Apologies for the issue with the screens.
Yeah, thank you, Jasmine. If anyone's got any questions, please do put them in the text. So far on those regulations, and Jasmine will try to respond if there are any queries about what the actual regulations mean. Next, we're going to go to Olivier, who still is actually a member of CPE, just to give his perspective really on what has happened here, why it's happened, why these changes are taking place.
Yes, thank you, Gareth. So forgive me if I don't provide you with any slides. In fact, it's more of a contextual story that I wanted to give you. So what has happened is we will all have seen around the country some DSPs that feel and look like a brick and mortar pharmacy. We have seen DSPs with 4 located on one street. We have seen DSPs with green crosses flashing above the door. And unfortunately, what we see, the department and the NHS also see. And therefore, what has happened is the department has felt uncomfortable about it, and it has come to CP with proposed changes, because DSPs were, according to DH, always designed to provide a national, not local cover, and therefore this is where the change is sort of initiated from. In terms of the position of CPE, it wasn't necessarily a lengthy discussions. There was, as you know, there is a DSP provider on CPE. That was never raised as an issue, and I appreciate that their circumstance may be different to those on the call tonight. Literally, it was approved as part of the deal that those changes, regulatory changes, would happen. As Jasmine has said, there's today an announcement made around the provision of COVID and flu services until 31st of March 2026. And if I was to be a bit sinister about it, that's probably because the department or the NHS may fear a legal challenge against those pharmacies who perhaps might have been offered a contract or an agreement to offer the service, and who suddenly couldn't. So, the NHS, could the NHS be in breach of its own contract? One would have to argue with that. With all that in mind, we are where we are, and unfortunately, my understanding, and I think CPE will clarify this, these changes have been, for want of a better word, approved by the committee at CPE, and therefore will be coming into place and not necessarily open for discussion. That said, it is not a valid reason for the NPA not to look at it and take a feel of the temperature. And we know that we have in the past, be able to influence, shape decision, and we're hoping that the work that we do with you may help this in some way, albeit at the moment we don't really know. We know the NHS is looking to change the regulation quickly. We don't know if it'll be October. We don't know if it'll be June. It could be next year. I don't have the answer to that question. I think whilst a lot of DSPs are offering a safe, reasonable, probably in many cases better service than other pharmacies, I think this all originated because some of the DSPs have become more and more regional or local or even down to the housing estate, and I think that wasn't the expectation of the regulation when it was introduced in 2005, and therefore today I think there's probably an expectation that a loop is trying to be closed. So I'm really keen as the chair of the NPA now to listen to members and to make sure that we take on board what you're saying, and you are our members. I want to support you. I'm hoping I'll come and see you to understand the dynamic. Richard Brand, who is here, I spoke to already. Whenever I'm heading down your way, Richard, I'll be coming to have a look. I think it's important that we understand exactly all the challenges that you face, whether there will be an appetite or time to change anything before this is implemented. There is no guarantee, as Gareth said. So I hope that provides a bit of context, Gareth. I'm happy for any questions now.
Thank you, Olivia. Well, the next thing we'd like to do before we ask Richard to speak is just do a few questions, just to sort of take the temperature of those on the call. So if we could have the first one, and I suspect I know the answer. Oh, in fact, there we are. Yeah, we've got them all together. That's great, actually. Yeah, if you can respond to those questions, just to give us a little bit of a flavour of the situation people feel that they are in at the moment. I'll just give everybody a minute to look at those and respond. I can't see how many people responded, Helen, so I'll leave it to you to close the poll once most people or all people have been able to make a response. Okay. I can't see the results at the moment. What I think I might do is ask Richard to speak, and hopefully once Richard's finished, then we'll have the answers to those. To that. Oh, sorry, here it is. I don't know if everybody can see it now. I can see it. Does this impact you? Yes, everybody. We thought that would be the case. We thought it'd be affecting COVID services, flu services, other services. Perhaps if you could let us know what they are in the chat. And yes, this is interesting. What will people do? So close the business for one person, for a number of people, cutting staff costs, expanding other private, other NHS or private services, and yeah, for some people, not yet sure. Okay. Well, thanks for just giving us a bit of a flavour there of how people are thinking. And yeah, Richard, over to you to give us your perspective on how you feel these changes are going to affect you.
Yeah, sure. So thank you for that, Gareth, and good to be able to speak to everybody as well, either tonight or if people are listening then on the recording. So just to put some context to this, myself and business partner opened a DSP. We applied for our contract about 3 years ago, and we purposely opened it up on a industrial estate in an office area of an industrial estate. To try and pick up that piece that Olivier spoke about, which was that bit about not looking like a normal high street pharmacy. So we set it up. We have a purpose-built pharmacy with 3 consultation rooms. It has a dispensary. It has no retail space. It is absolutely set up to be a health clinic. And it was absolutely built on the infrastructure that existed with the regulations as they stood at that moment in time. It is designed and built to offer all essential services at a distance, and that is, we would pick up prescriptions and deliver to anywhere in the country. There's no issues with that. I don't fall out with that problem in the slightest, and we've complied with the rules around the website. We also knew that we could offer advanced and enhanced services on the premises, because ultimately that's the way the regulations were written. The regulations were not written to say no pharmaceutical services could be offered on the premises. They specifically excluded essential services. So that's fine. That's perfectly okay. And that's what we all entered into as part of that contract. But it absolutely meant that we could do all those other services on the premises. And that was completely legal. That wasn't finding a loophole. That was completely within the regs. I do get people's sense that if you have a DSP next to you on a high street that looks like a normal pharmacy, then you might feel aggrieved if you are running your bricks and mortar business. I do get that piece. What I would say is this change doesn't solve that problem. That's the misnomer with this. The change in these regulations doesn't actually address the issue that people are trying to solve. It just means that all of those services are now offered at a distance. It wasn't the fact that somebody could come onto the premises to receive their NMS that was causing the problem. The big problem that people reported to us was that it was people were trying to provide prescriptions in the main and were destabilizing the local prescription model. So actually, it's really important that we note that these changes won't solve that problem. And therefore, it seems strange that they've been imposed in this way. And that's probably my big issue, the fact of this imposition. It's the fact that there has been no consultation around this. There's been no transparency around this. This is a fundamental change to a contract that all of us that open DSPs lawfully applied for, and let's work on the premise, deliver it in the way that it was designed to be delivered. If people are doing things that are wrong, if people are not adhering to the contract that they've signed up to, then that should be dealt with through NHS Singer, through performance management, not through fundamental changes to the contractual regulations. It's really interesting to think that there are plenty of pharmacies at the minute across this country that I'm sure we can all think of that are already breaking rules. And it's a real worrying precedent that if a pharmacy or a number of pharmacies in our sector don't adhere to the rules that are laid down, then fundamentally they can be changed that impacts everyone. And you only have to look at NMS as a great example where that precedent also flows through, and everybody gets affected by this change that wasn't consulted upon. So we should be really worried. This isn't just about the change to DSPs. This is about a fundamental way in which our contract is negotiated, and in this instance, altered without necessarily the due process being followed. And that's the piece I fall out with. And when it comes down to it, ultimately within our pharmacies, this is the sort of difference it makes. So this means I can no longer offer hypertension case finding service. It's a really important service that my pharmacy offered. We spoke to people, we looked after people, and we did it according to the contract. I think there's a real issue around whether we can offer the full scope of the contraception service because if they need to get blood pressure and BMI checks for the combined pill. We also can't do otitis media, and that was probably the thin end of the wedge that we probably should have reacted to when Pharmacy First was then commissioned. And I appreciate there may be some leniency with flu and COVID, but ultimately it still is going to be an issue next year if it's not this year. So there still is a real concern around that. And actually, for that service, that's about we could potentially still offer it offsite, but it would be a massively reduced profitability. And that's the issue for me again with this, is that ultimately this is then changing the financial model that a DSP can run by. This is excluding DSPs from parts of the financial contract. I don't fall out with the fact that there may be ways that DSPs might earn money in different ways because we operate in a different model. So therefore, if you take things away from a DSP from a financial remuneration perspective, there has to be some allowance to provide funding back in other different ways. It's unreasonable to just take money out of a particular pharmacy in a particular part of the contract. That's the bit that is, I think, unreasonable within this. And therefore, as a result, my business will be devalued. My P&L at the end of the year will be less as a direct consequence of this change, something I didn't ask for, didn't want, and actually everything I had done in setting my business model up was right and proper. And that's exactly the same if you're a bricks and mortar pharmacy and there's a future change that happens to you in a year's time. If it impacts your bottom line profitability, it's unfair and it's through no fault of our own. And that's that ultimately is where I have then grave concerns. So it is a wake-up call for the whole sector. This is not just about DSPs, it's a wake-up call for the sector, and therefore there should be a level of challenge that is put in. And the sector has to start to stand up for itself on these sorts of things. Because where there is unfairness, it's the opportunity for other people to come in and drive down our income streams. So my personal ask is that actually the NPA I see as a really important partner to be able to then step forward and actually, look for there to be no retrospective changes for this. This should then apply to future contracts so that people going into it know what they're getting into. And if they choose to apply for it in that way, that's fine. Or there is some other mechanism to recompense and compensate the DSPs that have already set themselves up and invested in that. But primarily, this is about stopping these changes happening in this way. And ultimately, that's my ask of the NPA as my membership organisation, is to be able to lead on that charge for me. I will happily do whatever it is required to do that, but as an individual contractor, it is exceedingly difficult for me to get that stance. Whereas the NPA has the gravitas that it can bring to that type of an argument, and to also, like I say, put a line in the sand for what things should or should not happen as a future precedent for the entire sector, not just for DSPs. So there you go. That's my thoughts on that, Gareth. That may stimulate some questions from colleagues on the call as well. So back to you.
Great, thank you, Richard. Yeah, and I think those points about lack of proper consultation and retrospective change to regulations, I think that they are strong points, and as you say, that they could be applied in other ways in the future. Just for everyone that's on the call this evening, if you want to make comments in the chat, that's fine. If you want to come on camera and make some comments, that would be great too. Helen can move you onto the screen. I think you just have to accept when she asks if you want to, but as I say, you don't have to, but that option is available if you'd like to. I will first of all ask if anybody does want to comment. And Michael, you've come on camera. I don't know if you want to give a perspective. Yeah, over to you, Michael.
Yeah, I agree exactly what Richard said. We got our contract 4.5 years ago, and the rules were the rules. And to change the rules now is just totally unfair. I get the Department of Health is probably wanting distance selling pharmacies to be like pharmacy to you, but it's not sustainable. It's not. They've only made a profit, I think, 1 year in 26 they've been going, and they're doing millions of prescriptions, and they don't make money. It doesn't work. Without the services, it's unviable. And since we opened, I think postage charges have gone up, I think, 5 times. It's just crazy. If you're posting medication out, you're losing money on virtually all of them.
Yeah.
So there's no reason why you wouldn't run it as a local business, because it doesn't work otherwise. The funding's just doesn't work.
And I think the irony with PTU, I think, is that they've made money delivering vaccines, made money on anti-obesity drugs. They never made money on dispensing, despite that being obviously the majority of their business. Thank you, Michael. I think I might come to Suki next. So Suki is the chair of the NPA's Policy and Practice Committee. We did in the committee last week have an initial discussion about this matter. So Suki, is there anything you'd like to say this evening?
Yeah, thank you, Gareth, and thank you everyone for joining us this evening. I can understand actually the anxiety that might come along with someone just announcing that part of your business model is now null and void. And listening to you all, I'm just thinking, for your strategic model, for your financial model, this is like someone's pulled the rug from under your feet. So I completely understand and I can hear you. From what I'm listening in terms of the changes, to me, there are some alarm bells that are coming up. I be very careful, that we don't demonize practice that is being done well. That's really important. And we need to be asking, or we need to be displaying what good looks like. And Michael and Richard, you demonstrate what you're doing is what good looks like. And to paint everybody with the same brush isn't very helpful. So I'm now wondering whether we need to be discussing how we illustrate that moving forward. And is there a way that we as a board, and we'll have to talk with our members, is there a way that we can represent you and try and show what the good does look like and why it's so vital? I absolutely understand that you guys do need the services element, and we may need to see how much of that is making up the sustainability of your businesses. So that's something that would be quite interesting to see. I wonder whether I actually agree with you, Richard, in terms of if these changes can be imposed without consultation, without anyone being asked, as a whole sector, we should be very concerned that this could be any one of us. So we shouldn't just assume that it's only DSPs that are being impacted, so it doesn't really matter to me. Tomorrow, the case may change and it might be everyone. And if the same principles being applied and they're looking at what appears to be bad practice, it might be more important if we engage and try and insist that good practice be imposed, and those that are offending and making the rest of us look bad are encouraged. We can't push anyone, but encouraged to do much better. And I think that sort of applies to where the weight loss management has been public knowledge and everybody's been talking about it. We need to highlight those practices that are being done very well. So that this might be where we can vocalize those points of view. I think it's really important. A lot of these services do make a lot of your bottom line. And I think if you guys can tell us what it is and what fraction, and we have a better overview on how you're practicing and genuinely what good looks like, it gives us a little bit more gravitas, as Richard put it, to put that argument forward. It is really important. I actually, genuinely sympathize with you guys, because I feel like that could have been me. That could have been my bricks and mortar pharmacy for exactly the same reasons, without any consultation. What is there to stop that happening anywhere else? Thank you.
Thank you. Olivier.
Thank you. And just so you know, on behalf of members, we had a CPE meeting, my last one last week, and I made these exact same points in terms of regulatory changes without consultation. And if we are worried about this, what happens when Hub and Spoke is a success and they decide that we're not going to have pharmacies at all, because everything's going to be delivered to your door by pharmacy to you, or by you guys, for that matter. So there is a bigger concern around the regulatory changes, and that's something that I have already flagged with CPE, and I'm sure that will be coming back up as discussions over the coming weeks and months at CPE. I haven't taken to these changes lightly. Am I in the minority at CPE? Yes, but then it's not the first time. When it came to voting for the deal, I was not necessarily in the camp of a yes, if you see what I mean. So it is not the first time. I'm not afraid of a fight, and I just wanted to make sure, because I can see some of the question being asked there about actions, about things like this. I have, in my role as representing you and our members, already made my feeling very clear at CP, but so I wasn't in the majority, and I think to get any changes or to even start any changes, it may take a little bit more people behind this.
Thanks, Olivier. Richard.
Yeah, I just wanted to come back to Sugi's point. Sugi, I would be more than happy to provide you with detailed information around what that then looks like at a P&L level. Whether that's you, Jasmine, Gareth, or somebody reaching out to me from the NPA, just in terms of what information you would like, more than happy to provide that to you. And I'm quite sure other colleagues that are probably on tonight's call or will listen to this later. So it might be worth, even when this goes out, just putting somebody's email address as to who would be the right person for any DSP that would like to get involved in that, so they know where to go to, directly. But yeah, more than happy to help with something like that.
Thanks, Richard. I really think it is important that all of you that have come on this call, the reason you've come on this call is because you value what you're doing and you're doing it well. And when someone tells you that other people aren't doing a very good job and you're being penalized for it, it really hurts. And I think that's what generally the pharmacy sector is feeling as a whole. But then to be individually targeted, I can understand why that can really, really, I can't say, but I understand. Don't worry.
I think we could go through the questions that have been posed. I'll have a go at answering, but I'm sure Eva and Suki, Jasmine might want to come in as well. So, can the NPA fight against this change? We'll discuss this evening the comments this evening with the NPA board, but I think certainly potentially in principle we can. I mean, just thinking through the discussion, I think due process, as in not there wasn't a meaningful consultation. I think that's a fairly strong line to take. Undermining business confidence because of these retrospective changes, again, I think that's a strong line to take. This isn't the right policy solution, this isn't the right solution to the policy objective, is another line we could take as well. So, I think I can't promise anything tonight, but I think certainly in principle that's something that we could pursue. If we're not able to access funding for vaccinations, shouldn't dispensing fees be increased for DSPs? I think that's very unlikely to happen. Dispensing fees are going to be consistent, whatever sort of model you provide. I don't think there's any. I can't imagine there'll be much scope for increasing those fees for DSPs. The next question: are the NPA going to refund any insurance costs in relation to the changes? I'm not sure I entirely understand that, because actually you'll still need the same insurance cover whether you're allowed to provide these services on site or off site. And unless I've misunderstood the question, I don't think there's any change in what sort of cover you'll need. Next question: are the general public aware of the changes coming into effect on DSPs? I'm fairly sure the answer to that one is no. The only people that really understand this are not even all pharmacy contractors, I think, are aware of this issue. So there's I'm not sure if it's something you think your patients might actually want to help support this and support you in some way here. That would be an interesting point to come back to, if you think patients will actually want to back this issue. The CMA, are they doing anything about the changes being proposed? So we've had a bit of experience with the CMA at the NPA. We've taken a number of issues to them, mainly related to the medicine supply chain, where we felt it wasn't working fairly and it was undermining the interests of independent community pharmacy, we've not been able to get them to pursue any of our issues. And what we get told every time is, the CMA is interested in issues that have an impact either on the economics for government, or actually an impact on consumers, where they will actually lose access to a service. So a lot of the issues that we might like them to look at in pharmacy, that just doesn't reach their threshold to take on an issue. And I suspect that would be the case here. They would say, well, patients can go to another pharmacy. They're not going to actually lose access to this service, and therefore it's not something that the CMA will worry about. Obviously, we can't be sure until we take it to them, but we've been to them many times and had those conversations, and that's the way they approach these issues. And okay, you're referring to COVID and flu vaccine insurance. Okay, Suki, did you want to add a comment?
Yeah, I was just going to say, I think it's really important that if you feel that your voice, and I'm sort of referring back to the question about, do the general public know about what's happening? I think that's a really valid point in terms of the sector as a whole. But if your DSP is providing a particular service for a group of your patients that rely on you, and it means they rely on you for those vaccines and those other advanced services because they can't get access to it. And I know we go back to those pharmacy deserts that have become public knowledge, and they hit the newspapers. I'd suggest perhaps it's really important if you can get engagement with those patients that you engage with. And I appreciate that a lot of your patients, they are remote, but saying that, good looks like having a good relationship with even those patients. So surely we've got some scope of bringing it to light in terms of how will it impact you as a business and how you provide your services if you've provided that continuity of care within that model. So I think there is scope for us to try and create some sort of public knowledge of that. And that's based on your own individual cohorts, I'd say.
Yeah. And actually, if anyone can share with us sort of case study information on how a cohort would lose, that would actually help any approach that we might make to DHSC and NHSC, because that sort of thing they would have to take note of. Richard.
Gareth, so I think there's something very important then to probably, if you can pull together a one-pager of data that you need, because obviously we've already there talked about some financial information potentially to build a case. You've also talked about patient perspectives. A one-pager of asks that could go out to your DSP members that's really easy for us to fill in. And I'm even potentially, you can see where my head's going with this. You can see there's an MS form survey somewhere in this, that actually we can collect that information for you. We can share it with the DSPs. You can get it back in some kind of standardized format. But absolutely, I agree with Suki around that patient feedback around quality of service, because nobody's doubting the quality of service that's being delivered. That's not the bit that's in doubt. It's this punitive change that we're discussing here. And ultimately, our patients will lose out. And that's the thing. So I think, Gareth, if there's something you can pull together, and I recognise we need to act rapidly with this, that collates that information, we can share it through our own personal networks and your network that you've got of members, and let's get something back in, because I think the power in that as well. And also, I've reached out to my local MP to say, this is how it's going to impact some of your constituents. And I appreciate that people who are local to my pharmacy, but it's really hard to do a flu vaccination to somebody who lives 100 miles away. And I'm not being flippant with that, but there are some services you just can't offer at a distance. Let's just be honest about it. So our MP is actually quite interested by these changes as well. And, so if that could come out, I think that would be really useful for us to do. And I'm happy if you want to use mine as a test bed for what could we easily glean.
Yeah, thank you, Richard. Yeah, we can do that in the next couple of days, get something out. And any help from anyone in this group to share it more widely would be really, really welcome as well. Because we know there are more people affected than there are on the call tonight, many more. So I think if you've got contacts with those people that you could link into this discussion, that would be really helpful. So I think we've discussed a number of ideas. I think so we will do a one pager asking for evidence. We'll take to NPA board a proposal that we raise the issues that we've discussed. Is there anything else anybody would like to raise whilst we're together? Okay. Well, Michael, go on.
Yeah, I was just wondering, obviously, for the past several years, the NHS has paid up to £200 for off-site vaccination services and paid you for portable fridges, etc. It sounds to me like they're going to stop that. I can't see them banning you from doing it at your premises and then paying you extra to do it somewhere else. But I'm hoping that they will carry on doing it, obviously. But I don't know if there's been any talk of that at all.
No, not that. No, it looks like none of us are aware of any discussion about that.
Okay.
So Suki, Olivier, is there anything you'd like to say before we finish?
I probably would just say that. Oh, sorry, Olivier.
I said nothing from me really, with the exception that I don't think there was enough thought put into all of this before it happened, and I think that's, if I was to put my hand up, probably a failure on my part. I didn't see this being the big issue that it is, in the same way as the NMS changes in a way. It's I suppose we are where we are, but we are we're not going to sue the government, where this is not where this is going. But there is certainly a piece of work that the NPA should explore with regard to supporting, challenging, and hopefully finding a way out of this in one way or another. So you have my personal commitment. As I say, I've already fed that back at CPE, and I will continue to look into this with the NPA and the board and the executive team. But yes, I just think, it worries me in a way. What else have I missed in that deal that's going to come and bite us? We are all humans. I work 18, 20 hours a day, sleeping 4 hours at night for about 4 or 5 weeks, trying to get this deal over the line before the 1st of April. Was it pleasant? No. Was it easy? No. Did my personal life, business life, everything suffer? Yes. And I am slightly aggrieved that we perhaps didn't get this one spot on. So let's continue talking, and hopefully with Richard and Michael, any information we can get on the funding, on the effect that it has on the decision that you make as a business, will be important, because you offer a service that other people's don't, and therefore, if you fill a gap for patients, for communities, then why not? But it is not something that's easy to get right every time for everybody, and I can only apologize if that is affecting you guys more than others. That's from me, really.
Okay, I've just seen another couple of questions. So I think somebody's asking for your email, Richard. I don't know if you're happy to share that in the chat. And can we arrange a follow-up once the data we've provided has been reviewed and proposed way forward has been considered? We certainly can. And I was going to finish by noting that we did start an NPA members online pharmacy services forum a couple of years ago, which hasn't met for a couple of years, but actually I think we would like to restart that to ensure that we've got a route to hear from this group of members. So we'll get in touch with everybody who came this evening, who invited to come to this evening, to get involved in the forum, so we can ensure that we have two-way conversations with you as a discrete group of members. Sorry, before Richard.
Yeah, so I've just I've answered that question for you. So if people look at the answered section, I think in the questions, they'll see my email. I popped it in there for people.
Great, thank you, Richard. Okay, well, thanks everyone for coming along. Thanks, Suki, Olivier, Richard, and Jasmine for contributing. I think thanks to Michael as well for coming on the camera and making some comments as well. We will be in touch in the next few days, and yeah, hopefully we can move something forward in this area for you. Good night, everybody. Nice to speak to you.
Brilliant. Thank you, everybody.
Thanks. Good night.